I was in an accident with my dad when I was about 8 years old. Ended up seeing double, had a speech impediment. It was interesting because the speech impediment got caught really quickly because people could hear it. The vision issue got missed probably for about a year to a year and a half. We saw multiple doctors. Eventually came across an optometrist who quite simply put a pen in front of me, said, "Have a look at the pen," and I just said, "Which one?" Of course, the doctor then turns to my dad and goes, "And you're wondering why he's having trouble with his reading." So that's when my journey into optometry started. Went through high school, didn't really think too much about it, and then at the end of high school thought, you know what, that was a really cool profession that I kind of got a glimpse into, because that doctor, through the use of lenses and prisms and vision therapy, was able to get me back to reading within 3 to 6 months. So after high school, ended up doing undergrad in Dublin, optometry in the UK, and then ended up coming to Canada to do my PhD and my postdoc, but I decided to do research into concussion, brain injury, and learning problems in kids. So that's how I ended up in the profession. It was really a personal experience. In my clinic, when we have a focus on visual rehabilitation, I'll typically come in about an hour before the clinic starts, so usually about 8 o'clock. I'll review all the records because I want to make sure that I'm spending time listening to what the patient is telling me. There's nothing worse than walking into an exam room and fumbling through papers while the patient is trying to tell you what's going on with them. So I tend to come in early, prep my files around 8 o'clock. I typically spend, for my in-depth assessments, about an hour to an hour and a half with each patient, finding out what their symptoms are, what their concerns are. Theoretically, you have a lunch from 12 to 1, hardly ever occurs. And then typically we're going till about 5 or 5:30. So it can sometimes be very long days, but when we're dealing with patients who have either learning difficulties or concussions, it's a rewarding day, even though it can be long. Eye exams for eye health and the detection of disease are essential because a lot of vision loss doesn't occur until late on in the game. So for example, your vision can still seem quite good for example, in glaucoma. Your vision can seem okay until it's fairly advanced. So I think the big thing to be aware of is typically blurred vision or vision problems don't come with pain. I've always joked that, you know, if eyesight was like your teeth and you had dental pain, you go see your dentist. I think the problem with eyesight is pain is usually quite rare, but when vision loss occurs to the point where you notice it, usually the issue is fairly advanced. So it's really important to get ahead of it. So find an optometrist that is a good fit for you and get a routine eye exam done every year to 2 years, depending on your risk factors. So in our practice, we have a focused area of care where we look at patients, two main groups. There's kids that have learning difficulties. We like to call them visually inefficient learners. So these are kids that will otherwise be quite smart. You can read a story to them, they can whip everything back to you. But when they read, there's tracking issues, they have trouble retaining what they've read. So we deal with that group as one group. The other group, which can be kids or adults, are concussion cases. So a lot of patients, if they have a fall or a knock, or if you're an adult, you get into a car accident, they will typically not have symptoms for a day or two, then symptoms of light sensitivity, double vision, tracking issues, trouble dealing with visually busy areas like walking into a Costco, which require a lot of eye movement. So the problem is you can still see 20/20 on the eye chart, but still have a lot of trouble teaming your eyes together. So that's the group that we tend to focus on because not a lot of clinics will deal with those issues in a lot of detail. So we often get referrals from other optometric colleagues to our clinic. So we try to, hopefully, our colleagues see us as an extension of their clinic, so that way the patient gets the care that they need. The most important way to care for your vision and eye health I can suggest is find an optometrist who's a good fit for you, get an eye examination done every year or every 2 years depending on your risk factors, and make it part of your routine. Put it in your schedule. Life is busy, we have work, we got family, we got other commitments, and often we put this stuff on the back burner. The problem is some vision loss when it occurs, if you catch it early, a lot can be done about it. But if you let it fester, things like glaucoma, diabetic retinopathy, I mean, in the working age population, diabetic retinopathy is a #1 cause of vision loss. So the problem is we don't tend to go soon enough. So I would say put it in your schedule, make it a priority, and get it done. I would say if you're choosing a career path, regardless of what it is, whether it's optometry or any other healthcare or allied professional field, don't do it because you think that it's what others want you to do. Do it because you're passionate about it. Making money is important. Anyone who tells you that it's not is not telling you the truth. It is important. You have to pay your bills. but you also have to be passionate about it. I think every person has an area of genius, competency, and frustration. You want to make sure that this area is in your area of genius where it not only doesn't drain you, but it actually fills your bucket to do that thing. I think that's the best advice that I can give people, because often people chase the buck, and that's not a recipe for long-term success or contentness, that's for sure.